The extrinsic laryngeal muscles have attachment outside of the three main laryngeal cartilages, the cricoid, the thyroid, and the arytenoids. These muscles are primarily responsible for support of the larynx and holding it in position or raising it or lowering it, except for the epiglottal muscles that move the epiglottis. Starting with the epiglottal muscles, the Thyroepiglottic muscle, of course, is superior to the thyromuscularis inside the vocal fold and inserts into the lateral margin of the epiglottis. Contracting this muscle will pull the epiglottis up, opening up the airway and undoing the action of closing the epiglottis over the larynx, which is done by the Epiglottic muscle. Detailed studies of the anatomy of the laryngeal muscles have shown that the Epiglottic muscle is basically a continuation of the fibers of the oblique arytenoid muscle. So these originate from the arytenoid apex, continue to go upward and laterally to insert into the sides of the epiglottis. Contraction of the Epiglottic muscle will pull the epiglottis backward and downward into the airway and covering the larynx during swallowing. The remainder of the extrinsic laryngeal muscles can be subdivided into two groups: the suprahyoid muscles, which are above the hyoid bone, and the infrahyoid muscles, which are below the hyoid bone. Suprahyoid muscles have the function of raising and stabilizing the larynx against contraction from below. This includes the digastric, the stylohyoid, the mylohyoid, the geniohyoid, the hyoglossus, the genioglossus, and the inferior pharyngeal constrictor. We will discuss these muscles in terms of their movement of the hyoid bone and the larynx in this unit, but these muscles will all reappear in the next unit when we talk about oral articulation, and in the final unit when we talk about swallowing. The digastric muscle has two different pieces to it, two bellies. The anterior belly originates from the front part of the mandible, our fancy word for the jaw, and is innervated by the fifth trigeminal cranial nerve. The posterior part of the digastric originates from the mastoid process on the skull and is innervated by the seventh cranial nerve. So why exactly this is considered one muscle, I'm not sure, but functionally the two halves of the digastric do come together at a tendinous attachment on the hyoid bone, and when contracted can raise the hyoid bone and either pull it forward or backward depending on how much effort is put into the individual parts. The Stylohyoid muscle starts at the posterior and lateral surface of the styloid process, which is another projection off the skull. It courses downward and forward, splitting into two parts going around the digastric muscle and inserts into the greater horn of the hyoid bone. Contraction of this muscle will pull the hyoid bone back and up toward the styloid process, so this would potentially raise the larynx or stabilize it against contraction from below. The Mylohyoid muscle forms the muscular floor of the mouth underneath the tongue. It originates from the mylohyoid line, a ridge running along the inner surface of the mandible. It courses medially and downward to insert into the body of the hyoid and also into a tendinous attachment known as the median fibrous ridge. Contraction of this muscle can elevate the hyoid bone as well as the floor of the mouth and as a result the tongue. The Geniohyoid muscle connects from the anterior part of the mandible, courses backward and downward to insert into the anterior surface of the hyoid bone. It is superior to the Mylohyoid muscle, as shown in this image. Contraction of the geniohyoid will pull the hyoid upward and forward when the mandible is fixed in position by other muscles. If the mandible is not fixed, this muscle can be used to lower the mandible if the hyoid is kept in place. The Genioglossus muscle, which will also be discussed as an extrinsic muscle of the tongue, has an effect on larynx position. This muscle originates from the upper border of the body and the greater horns of the hyoid, and courses up to insert into the posterior and lateral regions of the tongue. The Genioglossus muscle will be another one of our extrinsic tongue muscles. This originates from the anterior mandible, like the geniohyoid, so that genio part of both of these should trigger thoughts of the mandible for you. This muscle fans outward. Its inferiormost fibers insert into the body of the hyoid. Superior fibers from this muscle insert throughout the length of the tongue. So this muscle can be used to elevate the hyoid and draw it forward. Can also be used to move the tongue forward when we discuss it in articulation in the next unit. This muscle, like our other tongue muscles, is innervated by the 12th hypoglossal nerve. The inferior pharyngeal constrictor originates in the lower part of the pharynx and inserts into the thyroid and cricoid cartilages. This muscle has an important role during swallowing, but it also helps bring the larynx closer to the posterior part of the pharynx, and so will elevate the larynx. And if you, say, take a drink of water and swallow it with your finger on your larynx, you should feel the larynx get elevated as part of the swallow. Our other extrinsic muscles are the infrahyoid muscles. These are muscles that are below the hyoid bone. They can be used to lower the larynx or stabilize the larynx against contraction from above. The muscles here include the Sternothyroid, the Omohyoid, the Sternothyroid, and the Thyrohyoid. And again, these muscles will have other functions when we discuss oral articulation and swallowing later. The Sterniohyoid muscle connects the sternum to the hyoid bone. It originates at the posterior surface of the manubrium and the medial end of the clavicle, where the clavicle connects up to the sternum. It courses upward vertically to insert in the lower border of the hyoid body, so this will pull the hyoid bone down toward the sternum. This can also be used to stabilize the hyoid bone, for example, when other muscles are used to open the jaw. This muscle is not innervated by one of our cranial nerves, it's innervated by spinal nerves, and for the level of detail in this class, we won't discuss spinal nerves in more detail than that. The Omohyoid muscle is another muscle like the digastric that has two different pieces. It has an inferior belly that comes from the upper border of the scapula and inserts into a tendon that runs behind the sternocleidomastoid. The superior belly then comes from that intermediate tendon and inserts into the lower part of the greater horn of the hyoid. So together, contraction of this muscle can stabilize the hyoid against being pulled from above, or can lower the hyoid bone by moving it toward the scapula. This is another muscle that's innervated by spinal nerves. The Sternothyroid muscle connects the sternum to the thyroid cartilage, so it's much like the sternohyoid. This muscle originates at the juncture between the cornua and the lamina of the thyroid and inserts into the posterior surface of the manubrium of the sternum and also the first costal cartilage. This muscle runs underneath the sternohyoid and the omohyoid. Contraction of this muscle can lower the larynx. This muscle is innervated by a combination of the hypoglossal cranial nerve and spinal nerves. The Thyrohyoid muscle connects the thyroid cartilage to the hyoid bone. It can be either used to lower the hyoid or elevate the thyroid cartilage, which would raise the cartilaginous part of the larynx, depending on what other muscles are doing to stabilize. This muscle comes from the juncture between the cornua and the lamina of the thyroid and inserts into the lower border of the greater horn of the hyoid. It's also innervated by a combination of the 12th cranial nerve and spinal nerves. This image, taken from a different text, shows a variety of suprahyoid and infrahyoid muscles all together in one place to give you some idea of how these muscles can operate. So the more superior suprahyoid muscles can either be used to bring the jaw down toward the hyoid or raise the hyoid up toward the jaw. If the hyoid cartilage is stabilized by infrahyoid muscles, for example, contraction of the suprahyoid muscles would open the jaw. On the other hand, if the jaw is held in place, like if it's clenched during a swallow, the suprahyoid muscles would have the effect of raising the hyoid bone up toward the jaw, which does happen during the swallow. Overall, then, the balance of contractions between suprahyoid and infrahyoid muscles and how the attachments for those muscles are otherwise stabilized will affect the movement of the hyoid bone up and down. And since the remainder of the larynx is connected to the hyoid bone, that will effectively move the larynx up or down.